Honorable Health Minister Begego of Nauru, Honorable Health Minister Happy of Tuvalu, all the ambassadors and representatives to Taiwan, Deputy Minister of Foreign Affairs, Dr. Zheng Houren, Vice Minister of Health and Welfare, Dr. Si Songliang, Deputy Minister Li, members of the foreign diplomatic corps, distinguished guests, both here and online, friends from the media, good morning.
Good morning.
Let me begin by welcome every distinguished guest to the 2021 Global Health and Welfare Forum in Taiwan. Now in its 17th year, this forum has become an important annual event in the global healthcare sector. On behalf of President Tsai Ing-wen, I want to thank all of the public health and social policy experts in attendance for using this platform to share your valuable experience and for working together for the health and welfare of humankind. Since the outbreak of the COVID-19 pandemic, more than 240 million people have been infected worldwide, and almost 5 million have lost their lives. The pandemic has not only been a crisis for public health, but also for sustainable development. This year's UN Sustainable Development Report, published in June, revealed that for the first time, as a result of the pandemic, the average worldwide SDG index score was lower than the previous year. The report identified increased global rates of poverty and unemployment caused by the pandemic as the main reasons for the lower scores, and stated that the pandemic also forced 120 million people, 5 times the population of Taiwan, back into extreme poverty. The 2021 report noticed that in addition to recovery progress toward the SDGs, the pandemic widened the gap between the ability of rich and poor countries to achieve them. Although the pandemic helped highlight the importance of public health and access to critical infrastructure, it also shows that only these countries with effective social protection and national healthcare system have the ability to respond to crises like the COVID-19 pandemic. This is why now is the perfect time for the forum to tag sustainable society as its theme and investigate the short and long-term impacts of the pandemic on healthcare system, social welfare, and sustainable development. This is also an ideal opportunity to think about how policy, actions, and government programs can help us build a more resilient, equitable, healthier, and sustainable society. Because of Taiwan's experience with SARS in 2003, When COVID-19 struck, we took a comprehensive approach based on 4 principles: early deployment, rapid response, prudent action, and transparent communication. With Taiwan's democratic governance and technological expertise, we quickly integrated public and private sector, made resources, and implemented smart disease prevention measures using digital technologies like big data analysis. The people of Taiwan also actively cooperated with government measures, which helped the Taiwan model for pandemic response gain international acclaim. And although we have been successful this far, we are not letting down our guard. If the pandemic continues to have such a severe impact, it will prevent economic recovery and push us further from our goal of sustainable development. To respond to the changing course of the pandemic and the setbacks in sustainable development, Taiwan continues to adopt non-pharmaceutical interventions. We are also working to raise vaccination coverage and are stepping up R&D on vaccines, drugs, and reagents to control the virus in Taiwan. Taiwan currently has one domestically developed COVID-19 vaccine that has been given emergency use authorization. In addition, NRICM 101, a herbal compound developed by the National Research Institute of Chinese Medicine, has been shown to be effective in treating and preventing COVID-19. NRICM 101 is being exported to around 40 countries, including the United States, Canada, France, Russia, as well as United Kingdom, and other European countries. However, there are some members of the public who may avoid seeking treatment for other illness due to fear of contracting COVID-19. To preventing this from happening, beginning this past May, we expanded virtual clinical services and extended national health insurance coverage to telemedicine, with the hope that zero-contact treatment would reduce the risks of transmission and cluster infection. In addition, because of the impact that the pandemic has had on mental health, we are using public messaging campaigns as well as remote counseling, diagnosis, and the treatment, not just to prevent the spread of the virus, but also to help the public deal with the associated stress and learn how to adapt to the situation. This approach ensures that counseling and psychiatric care services continues uninterrupted. Moreover, to prevent the pandemic from disrupting economic activity and the lives of the workers, Our government have launched 4 rounds of economic relief measures over the past 2 years, focused on cash payments, loan assistance, and burden reduction. These measures have been designed to support industry and workers by minimizing the impact of the pandemic on our people and business. Finally, the pandemic continues to widen the inequality between rich and poor nations. Vaccination rates, for example, average 68% in Europe and the United States. But in Sub-Saharan Africa, average rates were less than 2% as of June 2021. With the continued global threats of the pandemic and with the challenges posed by vaccine supplies and the post-pandemic recovery, I believe that all nations must act in solidarity and support one another. We should ensure that extra vaccines, drugs, and critical supplies go to those in need. By speeding up vaccination for all countries, we will be able to more quickly reach a new normal of coexistence with COVID-19. Also, countries everywhere should collaborate to improve global public health, develop infrastructures, eliminate poverty, and minimize the impact of the pandemic on worldwide sustainable development. As a force for good in the international community, Taiwan stands willing to take more concrete action in working with other countries, both to protect the universal human rights to health and to fulfill our responsibility to the international community. We are ready to share our experience and make meaningful contributions, taking on more global responsibility while continuing to work toward our goal of sustainable development. In closing, I wish you all a successful and productive forum. Thank you.
Thank you to Vice President Lai。副总统请在台上留步，接下来是大合照的时间了。我们请副总统呢稍微移下右这个大合照。